My name is Robert Schlaberg. I'm an assistant professor in the Department of Pathology at the University of Utah and the medical director for HPV testing at ARUP Laboratories. Cervical cancer screening guidelines recommend cytology and HPV testing for all women aged 30 to 65 years. This unselected group is often called screening population. HPV testing is also used to determine the need for colposcopy and biopsy in women with ASCUS cytology. In this spotlight on test utilization, I will summarize results of large studies comparing the clinical performance of different FDA-cleared HPV tests for both applications. First, we will address the performance of different HPV tests in screening populations. HPV testing has a higher sensitivity for cervical precancer and cancer than cytology, which allows for an extended screening interval of 5 years if both tests are negative. Optimal sensitivity is important to reduce the risk of cervical precancer and cancer development between screening intervals. Maximum clinical specificity is desired to reduce unnecessary follow-up testing and colposcopy referrals. Because cervical precancer and cancer are relatively rare, studies to compare different HPV tests require thousands of participants. 2 recently published studies tested several commercial HPV tests with large numbers of women. In the first study, 6,000 women were enrolled. The design and size of the study make it best suited to evaluate clinical specificity. This graph shows sensitivity and specificity of the different tests for detection of cervical intraepithelial neoplasia grade 2, CN2. Point estimates are shown at the center of the cross. Vertical and horizontal bars indicate the 95% confidence interval. The higher up and the further left a test appears, the more favorable its clinical performance. In this study, the 3 FDA-cleared tests, Hybrid Capture, cobas, and Aptima, have similar clinical sensitivities. The Aptima test has higher clinical specificity than the other 2 tests. While Hybrid Capture and cobas detect HPV DNA, the Aptima test detects mRNA for the 2 HPV oncogenes E6 and E7. The second study enrolled 5,000 women and compared 2 FDA-cleared tests, Hybrid Capture and Aptima. Relative risk for CN2+ and CN3+ were used to compare tests. Higher relative risk means less unnecessary follow-up testing and fewer colposcopy referrals. Aptima positive women had a higher relative risk for CN2+ than Hybrid Capture positive women. Relative risks are highlighted in red. As a result, referral rates were 9.2% of Aptima and 13.8% for Hybrid Capture. Similar results for CN3+ were not statistically significant. Neither of the 2 studies was designed to provide long-term follow-up. Therefore, more studies will be required to compare long-term negative predictive values of different FDA-cleared HPV tests. In women with ASCUS cytology, HPV testing is used to determine the need for colposcopy. A recently published meta-analysis summarized results from 8 individual studies that enrolled more than 1,800 women. Similar to findings in screening populations, there was no significant difference in pooled sensitivities between Aptima and Hybrid Capture. On the other hand, pooled specificity was significantly higher for Aptima. Taken together, these studies indicate similar sensitivities for the examined FDA-cleared HPV tests and a higher clinical specificity of the Aptima HPV test in screening populations and ASCUS triage. The role of HPV testing in cervical cancer screening is also discussed in a separate short topic video on test utilization and a CME-eligible video lecture, both available on ARUP's educational website. Additional references are listed here. Links are also provided on ARUP's educational website.